DD doesn't actually meet the diagnostic criteria for factitious disorder imposed on another, formerly known as Munchausen by proxy. So why has she been labeled as such, despite her clear motive for financial gain? And why are we still playing along? Firstly, we need to look at Gypsy herself. Gypsy was having medical treatments prior to being diagnosed with a genetic condition in 2011. That genetic condition is 1q21.1 microdeletion. Here are some of Gypsy's medical procedures compared to the symptoms of this condition. Some may experience sleep disturbances including sleep apnea, hearing loss, low muscle tone or muscle hypotonia, joint laxity, mild facial dysmorphic features, a button-like nose and broad nasal bridge, a high palate, vision impairment, and eye irregularities such as wandering eyes. Ureteral reflux, failure to thrive, or poor growth and feeding difficulties. Gastroesophageal reflux disease, GERD, a shorter stature, developmental delay, and intellectual disabilities. Behavioral issues, aortic or heart irregularities, scoliosis, seizures, and more. There is even one documented case in which the child's seizures resolved.
And if the test results keep on coming back normal and the mother is firm that something is wrong, that is Munchausen by proxy.
Except Gypsy's test results did not come back normal. She claims DD pushed despite her having a clean bill of health, but her medical records paint a different picture. These are some of the tests doctors conducted for diagnosis and to determine best treatment. Lung capacity test, swallowing under X-ray, eye exams and testing, ear examinations and hearing tests, MRIs, reflex tests, muscle biopsy, sleep study, basic height and weight for percentile score, bloods and genetic screening. Most of the tests performed DD could not manipulate, or coax Gypsy to manipulate, to produce a desired result. Gypsy had procedures for eye muscle weakness, a muscle biopsy with a result of muscle atrophy type 2, Nissen fundoplication for GERD, feeding tube for failure to thrive, tonsillectomy, myringotomy tubes for hearing impairment, Botox injections followed by excision of submandibular glands due to hypersalivation and swallowing difficulty, plus dental procedures relating to tooth decay. She also had ureteric reflux, high palate, mild scoliosis, developmental delay, self-reported seizures, and was being treated for asthma. Almost every condition is linked to her genetic disorder, muscle weakness, hypertonia, being a reoccurring theme.
In my medical records, everything that is stated is talking about how the mother said this.
DD reported Gypsy was wheelchair-bound and had battled leukemia, but she was never actually treated for cancer. Almost all of Gypsy's real diagnoses that were actually treated correlate with her genetic condition, and all of this occurred prior to diagnosis in 2011. The genetic disorder did not come from DD's side of the family, and it can occur de novo, or as new. DD could not have predicted these conditions. It seems highly improbable that DD coincidentally manifested numerous ailments that aligned with Gypsy's genetic condition, and she was open to investigative testing of symptoms. In the few years leading up to DD's unaliving, Gypsy's only medical procedure was having her feeding tube changed. Which is so routine, people do this at home.
I would have been killed from all of the medical malpractices, the surgeries, the medication.
Gypsy's medications at the time of DD's unaliving included anti-allergen, anti-seizure, constipation, asthma puffers, antibiotics, pain relief, Valium. Hardly a death sentence.
It can typically be for money sometimes in some cases.
No, Gypsy, the diagnostic criteria for factitious disorder imposed on another, previously Munchausen by proxy, requires an absence of external rewards for diagnosis. You are describing malingering, which is distinguished from factitious disorder by its motivation. In factitious disorder, what you're referring to as Munchausens, the motivation is to assume the sick role, or carer, which can be thought of as an internal reward or incentive, whereas motivation in malingering is usually for financial or personal gain. Factitious disorder can occasionally occur with malingering. However, there is no evidence available that supports Gypsy's claims that DD was making Gypsy sick or pushing for surgeries with no supporting diagnostic tests. Yes, DD was a malingerer. She did run a financial fraud scheme. She did make up illnesses to gain financial incentives and benefits. Let me ask you this. How is lying about how many surgeries you had and falsifying medical abuse to lessen your punishment for a crime and gain sympathy and fame not malingering?
Muscle biopsy for muscular dystrophy is a very painful procedure, right? What do you know now about that?
It came back normal.
I have seen no proof Gypsy's life was in danger. No proof Dee Dee was horribly abusive and no proof that Gypsy has stopped lying.